Hello and welcome to Professor Kev Show. As you can see, I have my friend Arshia with us, and she is from Health Reach. Good morning, my friend. Welcome to the show.
Hello, lovely to be here.
So let's start at the beginning before we talk about Health Reach. Talk to me a little bit about yourself. What should we know about you?
So, I'm a senior at Hopkinson High School in Massachusetts, and I'm someone who's really interested in healthcare and science, but I also have a lot of interests outside of that. I love music, and I've been singing for 10 years and going, and I love writing and getting involved in my community. My favorite color is navy blue, although I have to say I've developed a pretty strong appreciation to white and orange, which happens to be the Health Reach colors.
Sure.
And I think I'm someone who's very curious and likes trying new things.
So let's talk a little bit about Health Reach. Why did you start this? What need, what opportunity did you see?
So I'm actually a co-founder of Health Reach, but my personal reason for starting Health Reach was I was in India, and once I'd accidentally ate an Indian sweet that I didn't realize had nuts, and I have a severe nut allergy,
Ooh.
and I had a severe allergic reaction. And so my mom and I had my EpiPen with us, but we were faced with a really difficult decision. We understood that using it meant that I would need to go to a hospital, and we weren't confident that we would have access to that kind of allergy care or information that I was used to having in the United States. And we also didn't have an easy way of getting to the hospital really quickly. So we ended up staying home and trying to figure out what to do. And thankfully, I'm here today, but that experience really stayed with me. And it made me realize that there are just so many battles that people have to fight just to receive adequate health care. And not all of them are just about medicine itself. Sometimes it's about access, sometimes it's about language, and sometimes it's about knowing what questions to ask or even knowing what that something is wrong. And we're often told that we need to advocate for our own health. But then you start to wonder, how can you advocate for yourself if you don't have the information to know what you're advocating for? And that's really where Health Reach came from. I really wanted to take healthcare information that can feel really intimidating or inaccessible and make it really understandable and useful for people in the community. And I really wanted to create something that helps people feel more informed, more confident um, when it comes to their health.
So tell me about some of the things you're doing to address this issue then.
So yeah, some successes that we've had are regarding social media. We've reached over 500 people through social media and visited nursing homes and presented some health topics to those homes. And we also held a workshop for younger students last summer where we taught them basic skills that um, we kind of thought was really really important. But I think something that really the best thing that comes out of this is I get to see people walk away feeling more confident about their health, and that's the exact problem that I wanted Health Reach to address in the first place. So I feel like that's kind of what we've been doing really well.
Now, where are you hosting these events? In Hopkinton? Are you hosting them in India? Where are you
So
hosting them?
So mostly what we do is we are both founders are in Hopkinton. However, we love going to like community fairs. We went to a fair in Woburn, Massachusetts. And that was an example of a really great success that we had. We had a stall and we talked about systolic versus diastolic blood pressure. And blood pressure is a topic that impacts all age ranges, all groups, and having a high blood pressure and a low blood pressure can signify certain things about your health. And knowing what that means, but also knowing what those numbers represent, not just hearing 120 over 80, but actually knowing what those things mean is so important and really imperative for health.
So what have been some of the challenges you've had to face so far with this idea?
So, with this idea, I think realizing that health education can't be a one size fits all. A nursing home resident, a high school student, and like a young child need to have information presented differently. And I think that I've had to personally learn how to take something medically very complicated and make it understandable without oversimplifying it because there's dangers on that side too.
So fast forward, crystal ball time, my friend. We're looking out 3 years from now. Where do you see this idea?
Well, in 3 years, I don't want to give you the standard answer of I just want Health Reach to be bigger. I don't just want Health Reach to be bigger. I really want it to be sustainable. I want students who are younger than me to be able to take over the organization in their own ways, be their own leader, and build partnerships through schools and community organizations and really bring health education into their own communities. Because obviously, I'm one person. My co-founder is one person, and the more leaders that we have, the more people that are striving to take agency, the better. And if Health Reach can continue helping people become better advocates for themselves, even after no longer leading it locally, then I think we've truly succeeded in 3 years.
So what's the best way for people to reach out to you? How can they learn more?
You can reach out to my personal Instagram. It's Arshia T, or we are on Health Reach. Health Reach does have an Instagram, and it's called Health Reach 111. And it should be a profile picture with an orange man hugging a white
Awesome.
colored man. Yes.
Awesome. I appreciate you taking a few minutes calling the show. And as always, thanks for being my friend.
Thank you.